Thanks, Mr. Chairman. Ms. Tavenner, let me go back to the President's words. I'm sure you'll be able to fix the website, and I'm not as concerned about the IRS fines that will come next year. What I'm more concerned about are the canceled policies and the inability of people to have time after you presumably fix the website by the end of November to replace their policies by January 1 so that they'll actually have health insurance. And I'm concerned about the kind of health insurance they get because of the large number of cancellation letters that are coming into our office from Tennessee. So let me suggest that a way to fix this problem of canceled policies in the individual market is to go to a website that does work pretty well. It still says, if you like your plan, you can keep it, and you don't have to change a thing due to the health care law. That's the White House website. Those are the President's words in 2009. So why don't we put those words into law? Why don't we solve the problem of Emily, the lady I read about from Tennessee, who's losing her Cover Tennessee insurance and finding that to replace it, it'll cost 410% more. Senator Ron Johnson has introduced a bill that he calls, if you like your health care plan, you can keep it. It would basically put the President's words into law and assure those millions of Americans like Emily that they'll be able to keep a plan like Cover Tennessee, and she won't be out of insurance on April 1. We're talking about millions of Americans, so my question to you is, would the administration support Senator Johnson's bill, which would put the President's words into law by saying to Americans that if you had a plan before the law was passed on March 23, 2010, or even a plan all the way up to the end of this year, that you can keep it? Wouldn't that solve a lot of problems and reassure many Americans that they can have affordable health care?
Senator Alexander, when we wrote the regulation back in 2010, that's exactly what we did. We grandfathered in existing plans, both in the employer market and in the individual market. There was a lot of back and forth about that regulation. What was the phase in time? What was so that's why we delayed it until we said basically plans could be grandfathered over this period of time, and also we allowed the grandfathering to continue as long as it did not reduce benefits significantly. There were some things put in place. So I do think we put in steps the ability to keep plans. Now, in these cancellation letters are also followed by a statement in each of them that says...
Ms. Tavenner, I want to give you a chance to answer, but will you support Senator Johnson's bill?
I would not. I have not even looked at Senator Johnson's bill. I'm happy to look at any.
Well, I'll get a copy to you. If I may say, we know about the regulations that were written in 2010. They effectively made it impossible to grandfather a lot of the plans that people had. And according to your own regulations, it was estimated that 40 to 67% of those individual policies wouldn't be able to be grandfathered because of all the conditions you put in the regulations. So in effect, didn't you know in 2010 that there'd be a big turnover in these individual policies and that it was wrong to go across the country saying that if you like your plan, you can keep it without having to change a thing?
I don't think the regulation assumed that it was because of the grandfathering that these plans would change. These plans routinely change. The churn in these plans is greater than 50% per year, often not renewed. People move about this market. This is part of what the Affordable Care Act was designed to do, is try to stabilize this market and give individuals some protection.
But your regulations said if you increase cost sharing, co-pays, change the employer contribution, change the fixed amount, change the benefits, all of those would mean that those plans didn't continue. And basically Washington is saying to people like the 16,000 who lose their Cover Tennessee plan, we know better than you do what is a good plan for you. We want you to buy a better plan even though you like the plan you keep. So why not put the President's words into law and simply say, if you like the plan you have, we're not going to decide for you. You can decide it, you as an individual. If you like the plan you have, you can keep it without having to change a thing. That's what's on the White House website today.
Senator Alexander, for those 16,000 individuals that you listed, they were also given the option of renewing with a new plan. And yes, maybe some of those plans were more expensive, but I would encourage those individuals to go on the website, take a look at what's available in the individual market in Tennessee. I think you will see that the pricing in the individual market actually came in about 18% lower. Also, some of these individuals may qualify for a subsidy. And so I would just encourage them to look at their current issuer, but also to go on the website, take a look at plans that are available in Tennessee, and also check to see if they qualify for subsidy.
Thank you, Mr. Chairman.